We know it can be hard to get help. CAMHS Live is here to help you access the mental health services you might need. Speak to our advisors about the right option for you.
The web address is provided, but in addition to that, a CAMHS Live search on Google or hashtag searches for CAMHS Live or My Mind Matters on Twitter will provide links to this service.
So this is a new service offered by CAMHS Early Response and Intervention Team. It's been live since early June. And it came from a bid for Health Education England innovation monies, identifying a need to have a different way of young people accessing services. I was able to talk about how our team have launched CAMHS Live, which is live chat for young people over the age of 13 to 18 and their parents and carers to access signposting by mental health clinical specialists, and also the potential for facilitating self-referral for emotional health and wellbeing services, which hasn't been done anywhere else in the country as yet, we believe. So we are trailblazing and we're learning as we go along and adapting this new service based on feedback and participation. From the original bid being offered, we started a steering group. We involved lots of people within NHFT that could advise us, but also some of the partner agencies that had some different points of view and different perspectives from different parts of the pathway for a young person and parents and carers. We engaged our user voice participation group. We have a participation worker in CAMHS, and she had some focus groups with young people asking for their views and experience to again influence how we developed this. We had a brilliant response from a GP survey. We had over 30 responses of GPs across the county giving a very positive response, thinking about how this would speed up access for young people to come into CAMHS appropriately, and I guess reduce some of their time and need to do so. And throughout the whole process, we've really relied on our staff team views because of them being the clinicians that will be delivering this service. It's really important to engage them and have a sense of ownership and involvement in the development, but also acknowledging that it's a very different way of working that we're used to not have the face-to-face, the body language, the engagement, the kind of sense of how well you're doing is very alien to us as mental health practitioners. So actually making sure that the staff had involvement to actually steer it and get some reassurance step by step as far as how we would actually be using this as a model. So as far as building the model, we used a standard operating procedure from Chat Health, the school nurse, as a starting point, and then adapted with some input from information governance, from clinical systems, and we had to consider safeguarding and risk management because it's a very much an unknown. We don't know who might be contacting us, in what state of need, and so really had to consider the safety element for the staff as well as the service users. So throughout the whole process, we've really used the staff group as the ability to reflect on how we might need to shape this service, how we develop the actual process, what it looks like, and we did a lot of role play and trial as far as what it feels like as a service user to access, and we were able to influence the development of the product, which is Verse 1, and they've been involved in the self-referral process as well in parallel. So, as I said before, ownership, steering and involvement of the staff team has been crucial, and I've really been very strong in my belief that modelling, being present and approachable as the manager of the team, and having a very proactive project manager that was part of it for a short term, to actually be responsive to the staff from soft launch, actually the practice of what was working well, what needed adapting immediately and what's needed to be improved on. We've shaped the product and how it's worked just in a matter of weeks. We've only been live since June. Okay. Any questions?
How have you found it kind of how's it been since you started?
It's been really interesting. Some young people have really liked it and have just tested the ground, got some answers, some signposting. Several young people have been in need of a referral into emotional wellbeing services, and we quite quickly tried to translate them into a phone call, because then the skills that we need actually are about getting more information and making some assessment, which is much easier over the phone, and we've been really successful in that. Yeah. Thank you.
Thank you.